Hello, my name is Amy Blythe and I am with Trihydro Corporation. Welcome to the webinar. Today we'll be discussing what's happening in terms of the latest developments in the PFAS world. We will cover implications of low-level treatment goals for PFAS, how to handle regulatory requirements, and minding environmental footprint of remediation. Before we get started today, I would like to go over a few housekeeping items. This webinar will be recorded and will be available after the webinar. We will send an email out to all of you with the recording as well as a copy of the PowerPoint. All attendees are in listen-only mode. If you have questions for our speakers throughout the webinar, please put them in your questions panel in the GoToWebinar tab as you see here on your screen. Finally, you'll have an opportunity to complete a short survey at the end of the webinar. Please take a few minutes to do so, as this information helps us plan our future webinars as well as gives us feedback on this one. Please place your topics about what you'd like to hear in the future from Trihydro with regards to webinars in the questions panel. All right. So I'd like to get started by introducing our speakers. First off, we have Mitch Olson, and he is a professional engineer with a PhD in environmental engineering from Colorado State University. Dr. Olson is Trihydro's Emerging Contaminants Director, and he has 22 years of professional experience, including industry and academia. He has been providing technical guidance to Trihydro's PFAS projects over the 8 years he has been with the company. Dr. Olson has been a member of ITRC's PFAS team since its inception 5 years ago and has contributed to the team as an author and a trainer. He has also contributed to PFAS guidance documents by the National Groundwater Association. Today, Mitch will be covering analytical methods and detection limits, unintended consequences, the connection between the low PPT remediation and greenhouse gas emissions. Next, I'd like to introduce Andrew Politz. He will take on the second part, or excuse me, he'll start us out today. Andrew is a board certified regulatory toxicologist with the Trihydro Corporation in the Tulsa, Oklahoma office. His role involves keeping tabs on environmental chemical regulations impacting industry and other regulated entities, inclusive of tracking rulemaking activities for contaminants of emerging regulatory concerns such as PFAS. He began his PFAS journey over 20 years ago, assessing bioaccumulation potential, exposure, and toxicity of PFOS and PFOA as part of environmental assessments by US EPA and Environment Canada. Today, Andrew will be taking on the topics of regulatory updates, both state and federal, evaluation of the rationale for sub-PPT, and the US EPA Health Advisory levels. So I'm going to turn it over to Mitch to introduce us, run over the agenda, and then he will take it from there. Okay, Mitch.
Thank you, Amy. Okay, next slide. That's good. For our topics today, Amy alluded to this in the introductions previously, but we have 4 key ideas that are all part of the running theme of this implications of breaking this PPT barrier and the kind of race to zero that's underway in terms of regulatory levels with PFAS. The 4 key primary topics here, as Amy mentioned, first 2 Andrew will be covering: regulatory updates and evaluation of rationale for sub-part per trillion levels. As if some of you may have been a part of our webinar about a year ago, November of 2021 it was, we had a webinar on regulatory updates and PFAS being what they are, ever evolving regulations that are underway. And so more regulatory updates, webinars may be anticipated as things continue to evolve, but Andrew will give the latest and greatest in that area. So parts 3 and 4 then, I'll step in on analytical methods, detection limits, and the unintended consequences, and looking into some of the, other impacts that may occur when we get very low in our treatment goals with PFAS. Next slide. Before getting into those, we have just this single slide here as a PFAS background, and really just to provide a high level. We really don't intend this to be a 101 level webinar and provide detailed background information on this, but just enough to establish some context for where we're going, and a little bit of info to set some terms that we'll be using through this presentation. So very briefly, the PFAS background, as all of you on this call are probably aware at this point, it's this acronym for this pretty horrible term, per and polyfluoroalkyl substances. The complex chemistry is one of the many complicating factors of PFAS. There's an estimated 10,000 plus compounds that have been identified. A lot of environmental releases might have hundreds to low thousands of individual compounds that might be identified. PFAS are ubiquitous in society. A big component, one of the many elements of the challenges of managing PFAS is just how widespread the presence is. And we'll talk a bit about that today in this webinar in terms of how that ties into the challenges of regulations and analyses and such. An emerging contaminant, of course, PFAS, an emerging contaminant, really the poster child of emerging contaminants. I think they call them the defining emerging contaminant of our generation. A lot of challenges around PFAS, not the least of which is the fact that they are so very stable and difficult difficult to remediate, both due to their transport properties and the relatively extreme stability, and also being subject to increased regulation. And that's something that Andrew will address today in his part of the webinar. And that's ever-changing area too, in terms of the level of PFAS regulation. So with that, Amy, you can go to the next slide, and I will pass the baton to Andrew.
Thank you, Amy. Thank you, Mitch, for the introductions. Hopefully you can hear me okay. If you want to give me a thumbs up and a nod, I'll proceed. And also, thank you, Mitch, for setting the stage. Next slide. So we only have 60 minutes in total. Looking at the clock right now, about 53 minutes remaining. So I'll go pretty quick. So the two topics I will cover in context of sharing with this audience the latest and greatest in terms of the regulatory status, but also looking, so to speak, under the hood. One, why some of the federal regulations, especially health advisories, are so low. So I'll go quick, and I believe you will get a copy of these slides, and also this presentation is recorded, so you can refer to these at your leisure. So this graphic is really the snapshot of what's going on right now with PFAS at the federal level. So the way to interpret this hourglass graphic is that the rule citations on the bottom, the regulator, they already have explicitly included PFAS within them. You can refer to legend for the acronyms. And then the sand, so to speak, above it is either about to undergo that rulemaking status change, or is currently in it squarely. So as we speak today, there are 4 major environmental regulations that are moving quite quickly in terms of PFAS. And these are the CERCLA, the Superfund, Clean Water Act, Safe Drinking Water Act, and the FIFRA, the Pesticide Act. So next slide, please. Right, so next a few slides will essentially give you a snapshot of each of those candidate top contenders of these rules. So in terms of the CERCLA, I think the issue at hand is the official designation of PFAS, specifically 2 compounds within it, PFOA and PFOS, as a hazardous substance. And we see this event as a trigger, not only changing the aspect of the Superfund rule by itself, but also causing domino effect on other environmental rules. In terms of the timing, I think we are now looking at 2023 and beyond then, but really there have not been recent announcements for EPA on anything that was more recent than proposing the proposal that was issued last year. And then in terms of implications, once these two compounds are officially designated as hazardous substances, there will be mechanism for cost recovery in terms of paying for the cleanup, remediation, otherwise pollution. And also another implication to keep in mind is that in addition to naming these two compounds as hazardous, I believe there's additional intent by agency to look at potential designations of additional PFAS compounds. Next slide. So going quickly again, the next one is the Safe Drinking Water Act. Essentially, this is the rule that regulates, protects drinking water from pollutants. And the key event is the draft, establishment, and final promulgation of the MCL and along with it, MCLG. I have another slide subsequent to this. I'll explain the difference for those of you who do not know. Again, we're looking at initially two PFAS compounds, PFAS, PFOA, and the endpoint, the envisioned endpoint, according to EPA's schedule and rulemaking requirements, is towards the 2024. But again, I think there's a little bit of a delay in the envisioned sequence of events as outlined in the PFAS map or action plan. So in terms of application, clearly once we have MCLGs established, there will be a requirement for monitoring, treatment, and otherwise compliance requirements. So it's quite a significant development that these two compounds are undergoing right now. Next slide, please. As I mentioned before, there's a little bit more detailed slide. On the right-hand side, you see the progression of various rulemaking steps for MCLs, MCLGs. Also want to make a note that EPA has made determination to proceed with MCL, MCLG development, as well as there's continued commitment to monitor these contaminant while the MCL, MCLG is being developed. The latest one is being implemented this year, the UCMR5. Also, just let's keep in mind that MCL is enforceable and based on considerations of health impacts, costs, analytical and treatment options and limitations, whereas MCLG, the guideline, is not necessarily enforceable and just looks mostly at the scientific merits of the limits. Also inserted is the current numbering or number system for PFAS and PFOA health advisory levels, also listed at the newest health advisory for PFAS and Gen X. But looking at those numbers, although as interim, they're quite low, and hence the title of today's webinar, and Mitch will cover some of the challenges associated with setting up those low limits. And also, if you read closely EPA's documentation guidelines and releases, it would seem that at least now they intend to take those health advisory levels and the science supporting these and move forward with MCL, MCLGs. But again, we don't know what the outcome will be, subject to reviews and other feedback mechanism to influence those numbers. Next slide. Right, and then I believe this might be a final summary slide for those top 4 contenders in current rulemaking process. This is the Clean Water Act, specifically looking at the water quality criteria. The draft quality criteria for aquatic life has been released, and then also awaiting the same type of limit for human health, and that's coming more in terms of 2024. In terms of the impacts, implications, there's two sets of effluent guidelines, or even pre-treatment is the technologically based, and I'll mention them later, but also there's the water quality based criteria, and both actually play into the NPDES permitting process, either delegated to states or under EPA's purview. There's a few states who do that. But nevertheless, there will be treatment, pre-treatment, monitoring, even on quarterly basis of the levels of certain PFAS compounds. So definitely significant compliance implications for all the industrial and public facilities. Next slide, please. All right. So to round off the federal actions, quick summary of something to keep track of. A watch list, if you would prefer to look at that way, for this year and next year. And I think the items listed in yellow, I would recommend that folks look like the closest. And definitely there's a lot of activity in terms of the TSCA, Toxic Substance Control Act. There is that proposed rule for retroactive reporting of PFAS compounds. Currently is in the draft stage, although there's some issue with the cost analyses that may actually derail the process a little, but nevertheless, I think the EPA will proceed with the rulemaking process in concert with the EPA seeking information on the adverse effects of PFAS compounds. They have issued test orders under TSCA. The TRI reporting, also quite a few changes there, designating PFAS of special concern, and that has the impact of potentially removing the de minimis exemption for any quantity. Currently, it says 100, I believe 100 kilograms or pounds per chemical per year. And also mentioned the water quality criteria there, and a little bit aside on NPDES permitting developments. And then this is something Mitch will talk about, is that there's continuous advancement by EPA in developing testing methods and such. And then looking forward, as I mentioned before, next year expected the water quality criteria for human health. Also maybe issuance of the technologically based ELGs. Something also that EPA is looking at right now in terms of risk evaluation is the impact of biosolids, specifically application to land and other uses. Okay, so I think we'll leave you with this slide, but I think the general impression that's out there is that the extent and the vigor of application of the federal rules and regulations to PFAS is unprecedented to compare to any other environmental contaminant that I had a chance to work with in my professional career. Next slide. And this is just a tipping of the hat to the state activities. Given the limitation of time we have today, I did not go into much detail in terms of a quick snapshot, looking at which states have issued some type of guidance or information to the public, and those states are marked in a darker blue or green, and those who do not have such guidance and information to public is in the light shade of gray. And what's interesting about this, not only that overall picture, but also the fact that based on a research or survey from ECOS, there's certain reasons given why these states did not proceed with PFAS guidance documentation. And there's three reasons. One of them is that they are prohibited from setting standards lower than EPA's. The second one is the lack in prioritization of limited resources. And then the last one is the citation is that there's still uncertainties in the toxicological, analytical methods, treatments, and such. So these are the main three reasons. And I suppose once more information is provided, then maybe those three reasons will fall off and other studies will come in. So next slide, Amy. This is the quick summary, top three lessons learned from the presentation on part one. There's no doubt there is heightened pace of multimedia regulatory activities, and that's inclusive of federal activities and states. Those states that proceed on that pathway. As you saw the insert, at least from the Health Advisory, there is a decreasing trend in the limits imposed in water, waste, and even consumer products at the state level, certainly. And then speaking specifically to the state agencies, in general, they mirror EPA's actions, but some may wait, but others have advanced beyond what EPA has issued in terms of guidance and regulations, and even establishing stricter controls. So with this, that's the end of part one summary, and now I will proceed with the presentation on part two. And I believe, Amy, we're going to hold up the questions to the end of the presentation. So now switching gears a little bit, next slide. Again, I will advance fairly rapidly to these sets of slides, but I believe this fits not only the part one, but also the overall themes of today's webinar, because really that's the, as I mentioned before, looking under the hood. What makes those low PFAS levels go? So here it is. And before I show you some of the numbers that EPA was using to derive the health advisory in some of the endpoints, let's just review what the agency is saying about the environmental and health effects of PFAS. So they are listed here. I'm not going to repeat them, but obviously agencies have concerns. And one thing I want to mention is that on the third major bullet in red, I really did focus on human health subject effects rather than something that we see in laboratory animals, simply because human receptors are closer to the actual effects that PFAS may have, even though there's still some uncertainty from the cause and effect, exposure, adverse impact this aspect. Now, also interesting in this slide, you might want to look at it a little bit later, but there are blood screening levels issued. Their clinical application is debatable, although it is nice to have those limits as a risk assessor or a clinician, physician. But again, I caution against using those blood level screening levels to draw any solid conclusions. Also interesting to note is that while the federal regulations mostly focus on 2 PFAS species, these blood screening levels are a summation of 7. Okay, so a little more advanced than just strict exposure to media regulations. Next slide. Okay, so the arithmetic behind the health advisory development is quite simple. you have three main mathematical input parameters. One is the toxicological data. The other one is exposure metric 1, which is drinking water intake, and then what I call exposure metric 2, relative source contribution, which really sets the percentage of the input of PFAS from water versus other sources, such as food and other sources. So it's quite simplistic, although the science going into each of these is quite complex. Next slide. Right. Real quick look at what EPA was looking in terms of the available data for these two compounds. You can see that they consider not only human subjects, but also animal, as well as models. And that's quite intriguing. And then also of interest are the effect categories. These are the actual adverse effects on which could be considered as endpoints for PFAS and PFOS health advisory setting. And I'll show you next which of these endpoints EPA has settled on. Next slide. All right, and before I show you those input parameters, I just want to maybe take 30 seconds to review the general model. And this is the general model that I guess conceptualizes the succession of events that need to take place between exposure or contact with phase 1 here, in the very general terms, all the way to the pathological outcome that is visible as a disease or otherwise some type of harm seen in the population level effect. And I think the key message of this summary slide is that the interim health advisory endpoints are operating within the stage 2, within the physiological adaptation of organisms that may be exposed to adverse chemicals. So yes, we are looking at perturbation of biological mechanisms, yet it is uncertain if those perturbations and changes actually express themselves as an actual disease. They may need some type of health protection action. So just keep that in mind. Next slide. And this will explain why this health advisory is so low. So here's a quick table of the input parameters in terms of the first metric, the toxicity reference dose that the health advisories are using. And they're listed for PFAS and PFOS. And then highlighted in yellow is the endpoint, is the toxicological endpoint that was previewed in the table before. And for both contaminants, the selected endpoint was some type of immune response. And specifically, this was a response to vaccines. Right? So again, very squarely within the physiological regulation adaptation of human beings. And then if you look at the types of numbers that are included in health advisories, you can see that 1.5, 10⁻⁹ milligrams, kilograms by the way per day, and 7.9, the same magnitude. So you think, oh, that's pretty low, all the zeros there after a digit. But if you think about general environmental contaminants out there that maybe some of you, most of you have worked with, such as PCB, specifically quite toxic, PCB 126, that's at par with PCB 126. I'm not saying that PFAS and PFOS are as toxic as PCB 126, but I think it's a good reference to think about the relative magnitude of type of numbers that those health advisories are based on. Next slide, please. And I'll move a little quicker, and this is really quick insert. The other one was concerning the protection of non-cancer endpoints. EPA also looked at the cancer endpoints. For PFAS, the agency did not find strong evidence, although it's suggestive. For PFAS there is, and then the cancer slope factor was established. And again, doing the same exercise as previously, just to like check, hey, I'm not familiar with these numbers, is it good or bad, high or low? Well, they're comparable within the range between, again, PCBs and dioxins, specifically 237A. So quite, the impression is that we are regulating at a quite low level, and certainly within well-recognized toxic compounds in the environment. Next slide, please. So finishing up real quick now, a really quick insert here on the relative source contribution. You can see that EPA's number is the lowest, and the way to provide interpretation is the most stringent. And then in comparison, we have other states' relative source contribution listed. But keep in mind that most PFAS exposure, based on multiple dietary exposure studies, is from diet, and tap water is not even the second, maybe the third most important exposure route. Next slide. All right, so here's the top three summary items for part two, and then I'll hand it back to Mitch. But definitely the reason why those health advisories are quite low is because they're based on subclinical and for selection, specifically the response to vaccines. And I would argue that they're certainly within the physiological management, adaptation, and control of an organism. Then further to that, just because there is a change in immunological response, it doesn't necessarily mean that there is a clinical or pathological outcome. So that link is uncertain. Of course, recognizing the need for sufficient conservatism to overcome uncertainties. Nevertheless, those numbers are quite low. And then finally, if we wrap our head around the types of levels in terms of endpoints we're looking at, definitely we going into the contaminants as toxic as PCBs and even dioxins. So with this, I'll thank you very much for calling in, and I'll hand the presentation, I guess, back to Mitch. Thank you.
Thank you, Andrew. Very good. So I'll step in now for the next sections. I'll talk about laboratory methods and detection limits with some comments on how things have changed over time and approaching that part per trillion barrier. So reframing some of the analysis of laboratory methods and looking at it in the context of where we're going with this webinar. And also provide some comments on treatability of PFAS in water at or below that part per trillion threshold. And then I'll follow that up with our final section on our evaluation into the unintended consequences. Now I'm starting off with a survey of currently available laboratory methods. This is focusing on the EPA's methods for PFAS. Now this table summarizes current methods. Again, focusing on EPA methods, but also the widely used EPA, the non-EPA 537 mod included for a bit of comparison here. But this shows some elements of these methods, which maybe some of which look a little esoteric on the surface, but I think I'll have some relevance to our discussion today, and I'll be referring back to a few of these methods as we go through this, and some of these elements of these methods as we go through this. So we've got a handful of methods shown here. Going through the table, the matrix that each of these methods is applied to is shown. We have 537 and 533, which are intended for drinking water, 8327, 1633 have a broader set of matrices that they can be applied to. And then the 537 modified, which, since it's not an EPA specific method, anything goes. It is as the laboratory has developed it, and anything you can throw at them, they've usually been able to figure out a way to apply some version of my 537 modified to. Going through the release dates here, this is set up in somewhat of a chronological order. We started off with 537. Hard to believe, that was way back in 2009. We had our original version of that method modified, and it was updated in 2018 with a broad expanded analyte list. 533 was added to for drinking water in 2019, 8327 also finalized in 2021. 1633 is in a draft method. I'll talk a bit about 1633 as we go through this too. There's been, it's been in draft, there's been a few revisions of the draft, and things are still moving forward. Additional drafts are expected before that goes final. In terms of analyte lists, they've generally increased over time, starting off with 14 in the old 537 method, up to 40 PFAS analytes in the recent draft for EPA 1633. Quantification, the approach used to quantify samples has also changed a bit over time. We see the two versions referred to are external standard versus isotope dilution. External standard is kind of the classic approach, worked fine for the old chlorinated solvent part per billion type of analysis under most circumstances, but for PFAS, due to their complicated chemistry and the analysis that we need to do in this low part per trillion level, isotope dilutions become the gold standard. Isotope dilution involves injecting samples with a cocktail containing isotopes of the target compounds that are analyzed in the same run as the target analytes, and provides a method for quantification within each sample, which provides much better, more accurate results at low concentration, and can control for matrix interference type of effects. Preparation is another important factor to keep in mind as we look at these different methods. Two versions shown here, solid phase extraction versus direct injection. The solid phase extraction, as the name implies, it's used for water samples or aqueous liquid samples. The water is run through a filter that accumulates the PFAS compounds, and then the PFAS are then desorbed into a solvent. So basically what that does is concentrate the PFAS constituents from a large volume into a small volume that can then be analyzed. There's some difference in sample volumes that can have some impact on the reporting and detection limits. And going through all this, that's really what all this is leading to, is the reporting or the detection limits for these samples. And I mean, that's where the rubber hits the road here, is can we accurately quantify our PFAS compounds at the levels that we need to in order to compare to the standards that keep going to lower levels, as Andrew was talking about. And briefly, on the difference between reporting and detection limits for those who don't work with these on a regular basis. The reporting limit is the lowest level at which a compound can be accurately quantified. Detection limit is a lower level than the reporting limit. It's a value at which a compound can be detected but would be reported as an estimated quantity. So typically how this shows up in a lab report, if its compound is present between the method detection limit and reporting limit, you'll see a J flag, and that J is defined as an estimated value. And then briefly running through these methods, we really, from our experience, have generally seen fairly similar reporting limits and detection limits. There's some overlap, a little bit of difference here, but generally fairly similar to what we can achieve, what we've seen achieved in conversations with labs, how they're generally able to approach this with some differences. And I would invite any folks from the labs who see this and have any doubts or questions on this, please feel free to chime in the questions, and we can talk in the Q&A. And then very briefly, some overview thoughts on the different methods. The EPA gave us this original 537 in 2009 that was used for the first UCMR monitoring program. Andrew mentioned this in his presentation earlier, that the unregulated contaminant monitoring rule, part of the Drinking Water Act assessment for MCLs, part of that process. UCMR3, the third implementation of that program from 2013 to 2015, used the EPA 537 method. The EPA added 533 as a drinking water method in 2019, an improvement on 537 because it includes the isotope dilution, which, as I mentioned, is a better, more accurate quantification method. A combination of these methods is what's being used on the upcoming, or actually just getting underway, UCMR program. The UCMR 5 is running from 2023 to 2025, using both of those methods in order to get the analyte list of 29 compounds. I'll also speak briefly here to 1633, which, as I mentioned, it's in a draft form. The third version of the draft was released in December of last year. And that included multi-lab validation for wastewater. And now we're awaiting the next version, which is supposed to have the multi-lab validation for additional matrices, including the groundwater and the surface water. The method can theoretically be applied to those samples. Once it gets the validation is complete, the confidence in those data will be enhanced. So that's expected early this year. And according to the EPA schedule, a finalized version that's going to include the other matrices, solid tissue matrices, we expect that to be released later this year. As noted here, 1633 did expand the standardized analyte list pretty significantly over what was being previously reported through these EPA methods. Okay, next slide. Thank you, Amy. As we are dancing with this EP part per trillion threshold, I wanted to do is take the slide to take a look at the EPA's health advisory levels, look at how they've evolved over time and how that relates to detection limits that we've been able to achieve, and kind of pull up from the comparison. So this slide shows is, you can see concentration on the y-axis versus time by year on the x-axis. And these two lines, the blue line is PFOA, the reddish dashed line is PFOS, and this is showing how the EPA's health advisory levels for these compounds has changed over time. Initially, we had provisional health advisory levels on the 400, 200 part per trillion range. That was dropped to 70 parts per trillion as so-called final health advisory levels in 2016. And then as Andrew mentioned, recently we have these part per quadrillion level updated interim health advisory levels. So through this time, and this is from my experience, that the two gray bars that you see at the middle here illustrate the general range that we've seen for reporting limits and method detection limits, and haven't changed significantly since the early 537 method. So although the values, reporting limits haven't changed significantly, I mean, there's been incremental improvements. What we have seen is a notable increase in our confidence in results as we get to that lower part per trillion range. Now this might be due as much to improved sampling methods and identifying materials that can be sources of PFAS, as much as improvements in other analytical aspects such as instrument sensitivity. Also in conversations with labs, they've greatly improved on identifying and eliminating contamination sources on their end as well. So although maybe the reporting limits haven't changed significantly in terms of where they would show up on this chart, another area that has changed significantly is the analyte lists. So we're used to see 1 to 2 part per trillion for maybe 6 to 14 compounds. We can now get to these levels for 40 or more compounds, which might be expected to change over time. There's an arrow on this chart you see here, this EPA MCLs with the question mark, just indicating that in the near future we expect to see the EPA come out with draft MCLs, which Andrew covered in nice detail previously. In terms of the detection limits and the timing of EPA's MCLs, and also factoring in the interim updated health advisory levels at the part per quadrillion level. I think when the EPA released these part per quadrillion level health advisory levels, one thing that we notably did not see was a race to lower detection limits. And in part that may be because there's a lot of infrastructure in place and we're pretty well anchored. I'll talk a little bit about this in a little bit more detail in the next slide, in terms of some limitations in trying to go deeper below that level. So next slide. Thank you. And I just wanted to frame up the UCMR monitoring that was done as part of this in terms of the timeline as well. And this shows that the time under which UCMR 3 was conducted and UCMR 5 is being conducted. And this is the published detection limits for PFOA and PFOS during that time. And the one point I wanted to make on this one is that the UCMR 3, the UCMR 3 was conducted under the original provisional health advisory levels, 200 and 400 parts per trillion. There was a lot of drinking water systems where detects occurred under UCMR 3 at these reporting limits, which were 20 to 40 parts per trillion. So basically an order of magnitude lower than those provisional health advisory levels. When the EPA released these final health advisories in 2016, there were several drinking water systems whose water became, say this air quotes, contaminated overnight, really, literally overnight, because of the change in those health advisory levels. And that created some kind of a panicked response to be able to meet those levels. Now, moving into UCMR 5, the EPA has released these much lower interim updated health advisory levels. So now we're in the part per quadrillion. And so we're dealing with detection limits that are in fact orders of magnitude higher than those health advisory levels. So basically any detect that occurs under UCMR 5 is going to raise red flags. Noted that that's versus a health advisory level, not an MCL. So when MCLs come in, that's going to really set the standard for comparison. Next slide. Okay, so speaking to what does it take to analyze the subpart per trillion levels, we've talked a bit about the currently available methods and their reporting limits are ranging from 1 to 4 part per trillion of reporting limits. Method detection limits can get below that 0.2 to 1 part per trillion level. As noted, the sub-part per trillion health advisory levels haven't really directly changed much from what I've seen in terms of reporting limits currently available. So thinking about what could be done in order to try to push those detection or reporting limits down. One thing that jumps right out, kind of the low-hanging fruit, is larger sample volumes. As noted, some of these analytical methods use the solid phase extraction to concentrate PFAS. So if you run a larger volume of water through that solid phase extraction filter, and then extract that into a solvent, that you can reduce detection limits. So for curiosity, ran some quick math here on what it would take to get to that 4 part per quadrillion level. So this is based on the current methods that require a 250 to 500 milliliter sample and then reducing the detection limit by a factor of 1,000. So it's really the difference is just a proportional calculation. Take 500 milliliters, reduce it by a factor of 1,000. In terms of the detection limits means multiply the sample size by that factor of 1,000. So that 500 milliliters becomes 500 liters, basically, of a sample, or converted to gallons, it's 130 gallons. So if you wanted to go this route to get to 4 part per quadrillion detection limits, be prepared to collect a couple of 55-gallon drums plus a little bit more in order to get to that level. But there's more that can be done than just collect larger samples. Newer generations of instruments, I think they are being made with more sensitivity. There may be some options in terms of better extraction or smaller extract volume from the SPE device, the solid phase extraction device. All these are really maybe able to provide incremental changes, but not the orders of magnitude that would be needed to get to those low levels. And regarding more sensitive instruments as well, it's worth pointing out that the laboratories are putting huge investments into new instruments, current generation of instruments, to be able to keep up with the PFAS demand that's underway right now. And my understanding is that's pretty challenging to do. There's just becoming so much more PFAS sampling being done. So there's big investment in the laboratory infrastructure to be able to analyze at these current reporting limits. If there was a big push to replace the instruments with something that might be able to analyze lower, that would be messy, I guess I'll put it that way, and I think that's a pretty major understatement. There's also an important consideration here too. This last bullet on here is how clean are your blanks? The analysis and the processing side is only one step in the entire process of generating a sample, and it's challenging enough from our experience to be able to make sure to be able to control every step of the process to avoid PFAS impacts, because they're so ubiquitous in clothing and sampling equipment and all that. So yep, I will leave that there and move to the next slide, treatment at the sub-part per trillion level. So I'll talk briefly here on this. We've covered in more detail in previous webinars, and the intent here isn't to go into detail on how to treat PFAS. But I'll just cover some high-level points and address the idea of treating PFAS at this level, getting below 2 parts per trillion. The well-established technologies for treating PFAS in water, primarily granular activated carbon or GAC, ion exchange, IX, and high pressure membranes. All of these are demonstrated to be able to treat PFAS to the part per trillion level. I would note that really the treatment efficacy is controlled by the detection limits. That's something that we see as part of the directive in terms of treatments is please treat PFAS to detection limits. I think these technologies are able to get there. But the challenge is that there's uncertainty in terms of what happens when you go below that part per trillion level. And in the next section of this, I'll actually go into that in a little more detail. We did an evaluation of other impacts in terms of when we try to treat PFAS to those levels. Destruction, I'll just say that there's a few destructive technologies that can actually destroy, erase the molecule of PFAS. They're generally not effective when you're trying to treat to this very low part per trillion level. They're just very, very inefficient. So generally the approach that might be taken is to use one of these absorption or separation technologies and couple that with a destructive technology where the destruction technology can be used on the concentrated waste stream that's generated. Next slide, please. Summary on what was covered in part 3. So as noted and is pretty well understood at this point, analytical methods continue to evolve. There's several methods out there, and we might see how things are going to continue to take shape. But we expect 1633 to become finalized here within the next year, and perhaps the drinking water methods will become merged at some point. If 533 was expanded to include compounds from 537, and then the folks participating in UCMR 5 don't have to analyze via 2 methods, that would be appreciated, but that's something that may happen in the future. So current methods are at or near that 1 part per trillion threshold. Reducing the detection limits is possible through improved analytical sensitivity, increasing volumes, but we really do need to consider the other factors. That's the existing instruments that would have to be potentially replaced, and then also need to consider ubiquitous PFAS and how to control that in terms of keeping our samples clean at the levels that would be needed to go to that lower detection limit. Also noted that treatment to low part per trillion levels might be feasible, but additional challenges are part of this. So next slide, please. Into the final section. Now, as a society, we've fretted a lot about the ubiquitous presence of PFAS, not without reason. We're also fretting a lot about climate change. And I don't want to speculate about which is more fret-worthy than the other, but I guess it's an indication how good we are as a species at inventing something that might be helpful and then producing way too much of it. Moving on, we've titled this last section as Unintended Consequences to look at an evaluation that we recently did involving the calculating of greenhouse gas emissions associated with lower PFAS treatment goals. This evaluation focused on the state of Maine, which was part of the purpose and what we were tasked with for this project. But the evaluation is broadly applicable due to ongoing widespread initiatives involving both PFAS reduction and greenhouse gas reduction. Next slide. So starting off with a couple of comments about greenhouse gas emissions, and I don't think there's a need to go into this in any great detail at all. I think it's pretty well understood, but that there are several state level and EPA greenhouse gas reduction initiatives underway, not the least of which comes from the Inflation Reduction Act, which included this greenhouse gas reduction fund. One number I wanted to put out there, because we'll refer back to this in the presentation, is the per capita CO2 equivalent footprint in the US, 15 metric tons per year. So some of the calculations we do will be referring back to that number. Next slide. Now the question that this work was designed to address is shown here. What is the cost in terms of greenhouse gas emissions of these ultra low treatment levels? This in the graphic shown here, it's attempted to be a visual representation of our research hypothesis here, where the concentration, which is something of a surrogate for risk, is on the y-axis versus level of water treatment on the x-axis. And our hypothesis going into this is that PFAS can be treated to ultra low levels, but with increasing water level treatment, there's going to be kind of a diminishing returns. And as we get to those ultra low levels, the greenhouse gas equivalent footprint, which is basically the footprint of what it takes to treat PFAS to that level, will begin to take off exponentially. Next slide. Now, this analysis is focused on the state of Maine. And there's several reasons for that, which I won't go into in detail, but suffice to say that Maine has an interim drinking water standard, which is 20 nanograms per liter for the sum of these 6 compounds. This was something Andrew referred to in his presentation as well, where in some circumstances, the sum of certain PFAS compounds are being used. And that was the case here for Maine with their interim drinking water standards. And they do have, they're in the process of evaluating these for a state-specific MCL. So there was part of the reason that this analysis focused on Maine was to do this analysis and get it, publish it, get it into the discussion for their evaluation. Next slide. So providing a probably oversimplified overview of the modeling that was done, but enough to give an idea of how this approach was taken. We looked at both domestic and municipal water supply scenarios. The difference between those scenarios being the number of users and the volume of water that was needed per treatment, and then both were normalized to a per capita basis. And assuming GAC is applied to an existing water supply system as well. So the assumption here is that we aren't designing a water supply system from scratch, but that GAC is not included on the water supply system at this point, that there's no need to have some treatment. So this is being added to an additional, an existing system. Influent concentrations estimated from the state database. The target treatment level range we evaluated started with that 20 part per trillion level, that sum of 6 compounds, and then both increased it and decreased it by factors of 2 and 10. So the values then that we looked at ranged from 2 to 200 nanogram per liters. And again, that's not a single PFAS compound, that's the sum of the 6 PFAS compounds. The calculated GAC quantity on an annual basis, and we calculated the GAC quantity using this published modeling approach by Burkhart et al., which follows the Freundlich isotherm. And then calculate greenhouse gas footprint using SiteWise software and published life cycle analysis values. Next slide. Now, the next 3 slides summarize the model output in different ways. So this is shows output from the first step of the evaluation. This is the calculation of the carbon quantity needed to achieve these different target treatment levels, the sum of 6 compounds. This ranges from 2 to 200 in terms of the sum of 6 concentration. We evaluated 2 carbon products. One was coal-based, one's coconut-based, and this shows that when we get to these very low treatment levels, the quantity of carbon needed to achieve those treatment does in fact go up significantly, that the treatment efficiency becomes much less at these extremely low levels. Next slide. And then this takes this analysis step further, where we the previous slide showed carbon quantity. Now this converts that carbon quantity into the greenhouse gas emission footprint. So that's the y-axis, and these shows the greenhouse gas footprint on an annual basis. Each of these pie charts shows how the greenhouse gas emissions break down. And this is based on published information in terms of the production and use of activated carbon and calculations that included transport. So that's what this shows, and I'll to cut to the chase. It's the production of activated carbon that's basically 3/4 of the emission footprint for activated carbon. Next slide. And from these results, we can convert these results and look at them in terms of that graphical hypothesis that we showed previously. And this shows really that this does follow the trend that we expected that it would. On the left-hand y-axis, sum of 6 concentration ranging from 200 down to 2, and then the resulting greenhouse gas footprint shown on the right-hand y-axis in these 2 charts. The 2 charts showing, one showing the coal-based GAC, the other showing the coconut-based GAC. Next slide. And then we can take that the greenhouse gas footprint and normalize it to the 15 metric tons per year. That's the standard per user US. I think what's fascinating on this slide is that we see in the worst case scenario, treating at 2 parts per trillion using the less friendly version of the GAC, the 2 that we evaluated, we can actually match the per capita greenhouse gas footprint 1-to-1. We're actually doubling the person's greenhouse gas footprint. And even in the better case scenarios, when we're treating to those extremely low levels, we might see an increase of 10 or 30% in terms of greenhouse gas. So it's a very significant difference in terms of gas production once PFAS treatment levels start to go to those low levels. Next slide. And we're running through our time, so I'll just really cut to the chase here in terms of the summaries. The key point here is that the greenhouse gas emission can be significant. I wanted to make the case here that we aren't advocating that PFAS treatment should be ignored, but also that the greenhouse gas footprint as part of the PFAS treatment process should not be ignored. That it can be very significant, and this really comes down to trying to turn these charts into which risk is society greatest able to withstand. So next question, next slide. Addressing PFAS, greenhouse gas and PFAS treatment. A few thoughts here in terms of the path forward and questions that can be addressed. As Andrew addressed in his part of the presentation, what treatment levels are warranted based on toxicology data? And then I think building on that, the question this evaluation is trying to raise is it fair to accept some PFAS risk in exchange for reducing the greenhouse gas footprint? There's more that could be done, looked into to reduce or increase the efficiency for PFAS treatment, which might include increasing the GAC efficiency or looking into alternative technologies that might be able to treat PFAS more efficiently in terms of greenhouse gas. Next slide. This is acknowledging our the folks who worked with us from the University of Maine, and this study was published at the citation is shown below here. Next slide.
All right. Well, thank you to both Mitch and Andrew for a wonderful presentation. Due to the timing on our event, I think we're going to hold off on questions. But with that, I will let you guys know that we'll send a recorded version of the presentation today, as well as the slides. And there is contact information in that follow-up email that it's Mitch's phone number as well as his email address, and you can see Andrew's email address on this slide. So feel free to shoot these guys a message if you have questions or if you need more information on a certain topic. They'd be happy to answer that. Again, there'll be a short survey on the closeout of this webinar. Please take a couple minutes and fill in that survey. And we appreciate your attendance today. Anything else, Mitch or Andrew?
Just thank you all for attending. And thank you, Amy, for coordinating.
Sure.
Thank you.
Thanks, everybody.